Okay, good afternoon. We are here today in our virtual City Hall, opening up our June 17th virtual Town Hall meeting. This has been an ongoing weekly meeting that we have actually designed in an effort to connect and communicate with our residents directly, with our subject matter expert teams that continue to provide accurate, up-to-date information that frankly has helped each and every one of us contribute to the health and safety to our community. So we are very proud of our residents, and as you will hear today in our updated comments, as well as where we are with our COVID response, really how much more we have to remain consistent, that we have to remain collaborative together, and to ensure that these numbers that we're seeing today continue to be a trend moving forward. And so I'm very pleased to continue to have such an extraordinary panel that really has been on the forefront of our COVID-19 response and continues to be so. So I'm always grateful to see our community health department officer, Bob Snyder, for our health department of Flagler County. Welcome.
Thank you, Mayor. Glad to be here again.
Absolutely. Our city manager, Matt Morton.
Good afternoon.
Thank you. Our fire chief, Chief Forte.
Good afternoon, Mayor.
And on the call with us, we have Dr. Stephen Bickle, who is our Chief Medical Officer, Director for our Health Department of Flagler County. I know Dr. Bickle has continued to provide us with valuable articles and information and conversations that he continues to have around the world in an effort to bring back that information to us to apply that here locally. So welcome, Dr. Bickle.
Thank you.
And I would be remiss if I did not also recognize on our call our Director of Emergency Management for Flagler County Emergency Management. Jonathan Lord has really been sort of the umbrella of the different stakeholders in the community that continues to drive our decisions in a way and an effort that has been unilateral, that has been consistent and helpful for our residents. So welcome, Jonathan.
Good afternoon, Mayor. Thank you for having me.
Absolutely. So as always, we're going to start off with our updates from our community stakeholders and partners, and then we will address some of the questions that have come in. Since this will be our last virtual town hall for the time being, if we need to resume these town halls, we will do so. We have the ability, technology-wise, to have them going immediately. If anything shifts or changes and we feel the need that we need to engage the community quickly, we will do so. And then we'll have sort of like a wrap-up of sort of the whole time frame of COVID, what we've experienced, what we've seen, what we've seen has been helpful, what we've seen has been sort of extraordinary, and a closing statement from each participant. So I will start always with you, Bob.
Thank you so much, Mayor, and good afternoon, Palm Coast. So I want to give you a quick little update. The three priorities of our health department still remain the same: diagnostic testing, case investigation, and good contact tracing, and our focus on our long-term care facilities and nursing homes. Everyone, testing in the county is going really well. The goal was to test 4% of our Flagler County population by the end of June, and I checked this morning, we've received 6,883 lab results for Flagler County residents, which surpasses that goal. And so far we've tested 6.3% of our population. Drive-up testing is still occurring at the Daytona State College Palm Coast campus. We're still doing testing at the health department and other locations in the community. Case investigation, contact tracing, all that epidemiological disease investigation activities are going well, at 100% on time, effective. We don't see any issues there at all regarding that very important function. And I did report the last 2 weeks that we were successful in testing all 72 congregate care facilities, whether it's a nursing home, ALF, large or small, group home for the developmentally disabled, the residents of Project Warm, and we've received test results on 1,500 people so far of residents and staff who work in these congregate care settings, and all the test results are negative. So again, that is a major achievement, and again, a testament to the nurses and the direct care staff, all of them, who work in these settings. So excellent results there. We applaud their efforts. So Dr. Bickle and I, we're going to continue to track daily about 10 indicators, and I'm just going to review 6 of the 10 real quickly here for all of you. So total positive cases right now in Flagler County stand at 214, and 172 are residents from Palm Coast of the 214. Total number of deaths, 5. The positivity rate over the last 14 days is still less than 1% for Flagler County residents. Number of nursing home or ALF residents still is at 0. We still have 2 staff members who tested positive long ago, and they since have recovered. Number of emergency room visits for flu-like symptoms and COVID-like symptoms are still downward and stable. And then just one more. We look at number of COVID-related like hospital admissions, and so far we only have 1 at our facility. So everyone, indeed, we are so fortunate in Flagler County with these good outcomes. We continue to trend in the right direction, and at the same time, we're succeeding in opening up our businesses and our economy. So, you know, we want to continue to learn how to live with the virus and the disease until that vaccine comes about. However, I got to say, we are concerned about seeing the resurgence of positive cases in 26 states, including Florida. This is due to increased testing, outbreaks in nursing homes and agricultural communities such as migrant farm worker camps, and an overall uptick in the mobility of all of us as the state reopens. The percent of positives for new cases the last 14 days in the state of Florida has jumped from 3.49% on June 3rd to 10.4% yesterday. But Flagler's percentage is still, again, below 1%. So we can see all places, larger counties around us are experiencing an uptick. So how can we continue to win locally in squelching the spread of the virus? Truly, by practicing 3 behaviors, right? Social distancing, wearing facial coverings, and effective hand hygiene. You know, the health department, Jonathan Lord and his team, emergency management, and the rest of our partners will take care of the rest. We'll take care of the testing, the case investigation, the contact tracing, and we'll focus on those nursing homes and the most vulnerable. But what we ask of you are those 3 things: social distancing, wearing facial coverings, and effective hand hygiene. Remember, the facial covering is an issue, not just for yourself, but protecting those that we know that you love and care about. Your children, your grandchildren, your parents, your grandparents, friends, and neighbors. This is, again, an inexpensive, very effective way and a small sacrifice to make for all of us to keep safe. And I know that Dr. Bickle is going to be talking more about this. So one last word. Last week, today at the town hall, I announced that we had 67,000 masks to give away, cloth masks made by Hanes. Well, guess what? You all responded enthusiastically, and within 5 working days, we've passed out 50,000 masks to families, churches, organizations, businesses, and whoever has asked for these masks. And we are ordering more. As a matter of fact, Matt, we dropped by a few boxes, few cases for Cynthia, for, people who come here to City Hall. So we're going to keep everyone in with masks, and we're going to give them away as quickly as we get them. So, yes for facial mask wearing universally.
Thank you for that update. Okay, now we will hear from Jonathan Lord to give the overall county update.
Thank you, Mayor. So let me first just say I can't help but reiterate everything that Bob said as part of my my share today too. That the fact that our numbers are lower than the state average and the overall state averages for percentage of new cases, as well as our growth in cases, as well as percentage, the recent percentage of cases reported positive per day. Those are all great numbers for our community, but I must caution, I truly believe, and I believe our health department does as well, and many other leaders in our community, that is because people are social distancing and wearing masks. I also truly believe that if we let off the gas pedal with that we will then join the rest of the state that is just seeing this astronomical rise in new cases statewide. So I definitely want to thank our community for doing the right thing and continuing to do the right thing. And please do not take your foot off the gas pedal, because I really don't want us to look like what the rest of the state is looking like. I think the mask wearing, just staying 6 feet away from people. Earlier this week, we had our first, the county level, we had our first commission meeting open again. And I really do appreciate all the residents that did come out to those meetings for either wearing a mask or staying 6 feet away from others. I know we kind of forced some of that with our seating, but just to see that people complied with that without any issues says a lot for our community, and we were able to do that. And so again, please keep that up. Our messaging will continue to talk about wearing the face mask and what social distancing means. That's very important. Some of the places where it's hardest to social distance are in restaurants and in grocery stores and retail stores. I know you can't eat with a mask on, but please make that choice to make sure you can find ways to be as distant as possible and wear masks when you can't. When you're standing in line in stores, grocery stores, regular retail stores, or walking up and down the aisles, many of our larger stores definitely went the extra step and put little markers on the floors and said, walk this way for this aisle and that way for the other aisle. Keep abiding by that. They're seemingly minuscule little things that really add up and do make a huge difference. And then our great stores and restaurants are all having their staff wear masks when feasible. It just additionally helps our entire public, because there are members of the public who cannot wear masks. We do realize that for medical reasons. But they do need to get out and get groceries as well and buy essential items for home. So knowing that the staff in the stores and the owners are wearing masks really makes a difference and helps protect our community. We'd like to see our numbers stay flat and not increase anymore. That's not a realistic of mine or ask of me, but everything that we're all doing just to keep doing that and just do not let off. Bob mentioned that maybe a year before we have a vaccine available in the community. So just folks, please keep that in mind. And if for some reason you can't afford and get a mask, there are many places available where we can get those. And just please reach out to us. Like I said, Bob gave out almost 60-some thousand already over the last week or so. I know there's a few more left. There's many other groups giving out masks. So, please take advantage of that and help us keep our community it's okay if our community is abnormal and we have lower numbers. That's something we can all be very, very proud of. But the only way to stay that way is to keep up the good fight. So thank you.
Thank you, Jonathan. Thank you for your continued leadership. Chief Forte.
Good afternoon. It's been an honor working on this panel and meeting with everybody and their talents and skills. I think back to the early days of when we first started closing things down, a lot of anxiety. There was a lot of unknown. We didn't know what direction the country was going to go and how the effect would have on not only the region, but the states and the country. So with that anxiety, the shutdown took place and it was accepted. Everybody wanted to do what was the best for everybody and protect those most vulnerable. After we got into the COVID epidemic, the stress of the lockdown and isolation was the next stressors that affected the communities and the country. And although they were 3 to 5 weeks into it, they still adhered to what they needed to adhere to because they still weren't out of the woods. There was no cost, no understanding of how long it would take for a cure, for a vaccination, and they didn't know how high the peak would be and how high the death toll would be. So there was still a lot of area of uncertainty. And then as we entered into phase one was a little bit glimmer of hope we called it guided optimism at that point. And locally in the city, we wanted to make sure that the actions that we took followed CDC, Department of Health, certainly Flagler Emergency Management has been a wonderful guide. But there was still a lot of that reluctance that went into that whole process. And through this whole thing, the idea was protecting those who are most vulnerable, who couldn't enjoy the freedoms of everybody else having that ability to get out in phase one. As we entered into phase two, there was more monitoring, added testing. We continued the protecting of our vulnerable population. And as long as the numbers continued, and that's what we always stressed, the numbers had to continue to either maintain or decrease over periods of time for us to feel confident to open up the next section of the phase opening. So that brings us to today. We are not out here out of the woods yet. The state numbers are rising. A lot of it's got to do with the testing that's been going on, but the local numbers are still consistent. We're not on a dramatic increase, but that doesn't allow us to have the opportunity not to forget about those who are most vulnerable or to go back on what our protection plan is. I'll go back to a trade school. If you're learning to be an arc welder or you're dealing with metal skills, they tell you to wear a mask because those things will affect your eyes. In the fire service, you wear a breathing mask, and that protects your lungs. If you're a law enforcement, you wear all kinds of face shields and body armor. You protect yourself, and we're at that same point in our existence as a society that we have to make sure that these procedures are not only in place, but they're utilized all the time so that any of these protections that are coming out as recommendations should be adhered to. Otherwise, you have the ramifications of someone who is very sick or loss of life. So as we get to further into phase two, as a city, we're welcoming back staff to City Hall. We looked at processes and access to all the locations inside of City Hall. We've had our fire marshal in today to do the inspections and calculations on how many people can actually stay in the main room and how many people need to go to an adjourning room if we have city council meetings. We looked at the process of moving people into the building in a safe, orderly manner, which was unusual, especially to me. I'm used to going into the building one way, and even I'm being redirected to go into another way, so it's more convenient for testing and monitoring. We've taken the opportunity to open up the Parks Department. We started with the trails at the end of phase one and beginning of phase two. Then we went into the pickleball, tennis courts, the golf course, and that started to give a resurgence of normalcy. But it came with a caveat of having to do it with special circumstances and personal protective equipment and decontamination. And as long as we keep sanitizing and maintaining these processes throughout, we can continue to expand our freedom, so to speak, into the society while still protecting those who are most vulnerable. Even most recently, we've had the day camps open, which was something that I know the Parks and Recs Department have been looking forward to for a very long time. They have come up with unusual alternatives to day camp, where the children are isolated and separated, but yet they still work in groups. And even those kids are tested before they get in, just like everybody else. And not that I'm fearful that this is our new way of life, but if we're going to take this seriously and reduce the surge in the future, we really have to take the time to make sure that we're checked before we go into any of our facilities. No one wants to talk about the new, but the new is here. And if you're going to be in the system and you're going to be part of the government, or if you're intended to go out to do something, it needs to come with the caveat of protecting yourself and protecting other people from yourself. So I think the city's in a good condition. We're in good shape. July 7th, we open up that week to the public, to the City Hall. It's going to be good to get people back, but has to come with protections that are built in place. And that's why we've taken our time under the recommendations of Jonathan and the CDC. Certainly, Bob and the Department of Health have been a huge asset for us. I think we need to continue to move in this defensive mode.
Thank you. Matt?
Thank you. So I would echo everything everyone said so far. And one of the comments I've heard consistently, I'm going to repeat the word from people who have contacted me, has said they've appreciated how steadfast, consistent the city has been in reopening. And so I will reemphasize that we will continue to be consistent, and we have been consistent. Mayor, you came out very, very early on in the county and with a recommendation for everyone to stay safe, a recommendation for people to take certain precautions. I think, as Bob has said, as Dr. Bickle, as Jonathan Lord has said, as Jerry has noted, these things have helped us. They have helped our community stay healthy. But now is the time to continue to be consistent. And so from an operations standpoint, here at the city, you will see that consistency, us walking our own message. Our employees are wearing masks in common areas and hallways when they enter and exit the building. To the chief's point, it's been new for all of us. We have a single entrance for employees to be screened, to get the temperature checked, to do the wristband. We're going to have an entrance for the public for the same process steps. There will be a mask requirement to come into City Hall. There will be a temperature screening and questions. I keep reiterating that because we do not want to catch anybody by surprise. Thank you to Dr. Bickle and Bob Snyder. We will have masks to give to the public if you should forget it or do not have one. We want to, have that opportunity. We don't want anyone to not be able to enter City Hall, but new guidelines. Similarly, as we reopen, we're reopening meetings. I know the chief mentioned city council meetings will resume in early July. With those same criteria, we'll have spacing. The room will have been sanitized and will be sanitized after the meeting. We'll be requiring masks and temperature checks and health screening. When our planning and land use board resumes, it will follow those same criteria. I think now our biggest challenge, and these are a lot of the questions we've gotten, is when will this segment open, or when will that segment open, or when will that activity resume? And again, we continue to move consistently. We are not moving deliberately slowly to frustrate anyone, and we've been I am very grateful that our community has been extraordinarily supportive. The majority of contacts I get are thank you for the consistent approach. Thank you for the guided and careful approach. Thank you for the well-reasoned and scientifically informed approach you are taking as a city. And so we will continue to do that, continue to follow the recommendations. We are things happen quickly going in, as everyone has mentioned. We entered into this pandemic very quickly with a lot of changes. And then initially it felt like we were coming out very quickly with a phase 1, weekly announcements from our governor, and then a phase 2. And now we're here in this holding pattern, but it's not really. There is no stasis. I had a call this morning, and as I think you mentioned, Bob, St. Johns County and Duval County are experiencing extraordinarily high resurgence rates of transmission of COVID-19. It continues to be present in our community, continues to be a real possibility. And so, as we continue to open and we engage with our residents, we're going to ask for this consistency, for them to continue the choices that they've made, the good choices that have helped us get where we're at, and to continue to work as a community, as we have, to be resilient in the face of this continuing pandemic.
Yeah, and it does continue. And speaking of that, before we go into the questions, it's an interesting moment, because I know that when the governor issued the lockdown orders, everyone immediately complied. It became sort of a very unified moment across the state of Florida. It was jarring, it was jarring to many, and we have felt that, and we have felt the impact. However, during his phased approach, the reopening strategy, and taking into account the Surgeon General's opinion, the task force that he assembled in an effort to do it safely. I know it started with, groups of less than 10. And then, phase 2 moved into, and it's, I'm not sure if we're in a full phase 2 yet or not, but phase 2 was groups less than 50, but still following the CDC guidelines with, please wear masks, please stay at home if you're not well, please make sure social distancing applies. And so phase 3, with the state now seeing such an increase in cases, we have no indication when the governor is going to give any type of order to go into phase 3, which does continue because we are under the governor's executive order to be consistent with that. So it's my understanding, and please panelists, step in if are you hearing anything of when that would occur, how that would occur, because that would then allow groups larger, right, than 50 to be in one location, but still, I'm assuming, applying those practices that are so essential to mitigate the spread of the virus. So we are working under the premise that we are still very much in phase 2.
Yes.
That the strategies that we are outlining today as far as our city government strategies or the health department approach or the county, county commission meetings beginning or constitutional officers reopening strategies, we still very much are under the guidelines of Governor DeSantis's executive order, and that has not changed.
Correct.
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 And Mayor, if I may add on to that, and I want to reiterate something you just said about a minute ago. So just because we're allowed to have groups of 50 does not preclude the social distancing guidelines.
Yes.
So that's the reason why, and we have to have at the county level, county commission meeting with spacing as well as masks as well. So just the 50
That's a great
thing.
point. Yeah.
That group of 50 still requires that social distancing within that group.
So that's why these initiatives and these issues and these conversations happen on a daily basis, because we are equally trying to, reopen as safely as possible, but do it within these very specific, strict guidelines. And so that's just very, very important to continue to communicate to our residents that we have appreciated the patience, but there is a reason why mask wearing is still continuing to be such a significant aspect of this. And I'm going to pose this to Dr. Bickle because, I know he just really dives in with these questions, but has done a tremendous amount of research, and not just research in one specific area. I'm talking universal research, really trying to fully understand how the virus is spread, where it is currently, how it's being transmitted in other parts of the world and the country, and why those spikes are continuing to see in different areas of our country, in particular the states that you'll talk about a little bit, Bob, as well. So Dr. Bickle, what will it take to make masks mandatory? The majority of residents that could be asymptomatic or walking around without any masks, therefore potentially endangering us all. In light of new evidence, CDC recommendations wearing cloth face mask coverings in public where other social distancing measures are difficult to maintain, grocery stores and pharmacies, especially in these areas, significant community-based transmissions. They mentioned are food service workers required to masks? They mentioned, is there any science linking mask wearing to herd immunity? And then we're going to cover all the mask topics under you, Dr. Bickle, and Bob, and Jonathan, and Chief, and Matt, please feel free to add any additional comments. But the final portion is discuss any importance of masks and any new case studies of research announced recently that supports this guidance to wear facial coverings and when. So, I know this is repetitive, and I know it's something, and we're going to continue to stress, and it's not going away, but the science and the data is particularly relevant and important to this topic. So Dr. Bickle, can you really take on the mask discussion?
My pleasure. I think, first of all, I think the evidence supporting mask use is mounting. It's steadily increasing. It's a complex area. It has to do with this particular virus, how it's spread, the people who have it, are they symptomatic or not when they can spread it? What we've have, case studies basically of other countries using it and being very successful. So there's from a variety of angles, there's evidence that it's not just useful, but like a core component of a successful containment strategy. So not just, generally of value, but like a main feature. And there's a couple of reasons for this. One is, if you look at the four pillars of our strategy, they're mask wearing, testing, contact tracing, and then general social distancing measures. Testing and contact tracing are things that the health department, the emergency operations center are taking care of. We're doing it for you. Mask wearing doesn't really have a downside. There's really no trade-off. I mean, some people think it's mildly uncomfortable till they get used to it, but basically you can go around, carry out your normal life. I mean, there's no downside. Every social distancing measure has some impact on people's ability to interact in their economy, in their social life. So there's a bit of a downside, a trade-off between those two things. Mask wearing is not. So it's kind of a no-brainer. I mean, if I were, king of the United States, I'd probably mandate mask wearing, but I'm not, and I understand that there are trade-offs, and that the reason that people aren't pushing it harder is that they don't want to take away people's freedoms. But as a strict measure in terms of a strategy, it's vital. And it's funny. Just this last week, I've been thinking about herd immunity because it's kind of it's a topic that's been bandied about, for months. So basically, herd immunity means the ability of a group or herd to protect themselves from infection that's above and beyond the ability of an individual. It has to do with group interaction, susceptibility of individuals to infection. And so there's one way to achieve herd immunity, which is probably to get 60 to 65% of the population infected, which according to the most conservative fatality measures would result in 1 million people dying. And it might take us 5 years to get there, 3 if we're lucky. And that's one way to get herd immunity. And then what would happen then is that if, presuming the antibody effect lasts, people who had the antibodies would, even if they're exposed, wouldn't get infected. That's one way to do it. Another way, it's a little different, but another way is wearing masks. So if everybody wears masks, or even that same figure, 60 to 65% of the population, what it means is those people aren't spreading it within a group. So it's kind of creating a herd immunity. So people should think about it this way. They may not be doing it. They may feel invincible and they're young and healthy and they like their freedoms, but it's a contribution to our collective ability to prevent the spread of this infection. It's a way of creating herd immunity. And the more we do it, the more it means that people can resume their normal lives. I mean, I know the mayor and the city manager are extremely cognizant and concerned about the impact of this on the community's businesses, and trying to weigh these trade-offs. This is a way to free up the rest of our activities while just doing this measure that's really minimally intrusive. So the evidence is strong for it on many levels. The effect is dramatic. The downside is minimal. It's kind of a no-brainer. And what I'm hoping is that people will, people who want to preserve their freedom, keep their freedom, will take this on as just a responsibility. That just brings to mind, John F. Kennedy's famous words: "Ask not what, you can do for your country. Ask not what your country can do for you. Ask what you can do for your country." And what I've seen in the last few months has been all of the people who just spoke earlier. All of our city and county officials have been concerned, focused, diligent. Their responses have been measured. They've been creative. They've been proactive. They've been strategic. They've taken this on with a passion, and they've done an amazing job. But now we're asking you, the public, to help us, continue to be successful in this arena. We've reached a stage where we are opening up. Mask wearing and things like that can prevent this. Contact tracing is another one, are just vital now. And the other thing is contact tracing only works if the numbers are low enough that we can handle it. So once we get overwhelmed with new cases, you lose your ability to do that. Every case means 10 to 30 people you have to contact trace. And that only works when the numbers are low. So it's actually kind of a core contributor to that program being successful. So, I'm sure we sound like we're a broken record, but it's because it's so vital, and we're just trying to get this message through that we need to, hang together as a community and do the things that will really help us succeed over the long term.
Yeah, and that's very well put. I mean, it's interesting to me because when we first were faced with this sort of response to this pandemic, it's certainly something I've never seen or witnessed in my lifetime, and I'm sure many are in the same place. And, the health department exists because, frankly, they do a lot of work in the community that identifies and helps and educates the reduction of spread of transmission of diseases.
Right.
It's the role of the health departments across the country. This just happened to be occurring under your time as a health director and medical director. So the science and data has really been critical and very important, and it has sort of shifted. I mean, Dr. Bickle, I remember first speaking to you very early on, and there was the thought of masks, and everyone was questioning, does this help? Is this a helpful strategy? And the more that we learned about the transmission and the virus and how it was truly spread and how we could create strategies to mitigate it, that's really truly when mask wearing became that key strategy, when we understood more. And so this has progressed, and the conversations have been progressing and are very fluid throughout this. And I've been through hurricanes in this community. I've been through wildfires in this community. I've certainly spent time in our EOC when it's activated. And, when Jonathan Lord stands at a podium, or when Chief Forte, stands and directs city department levels to adhere to some of the safety practices that we're requiring to get through an event and then post-event, for some reason, those aren't necessarily controversial. I mean, when you think about downed trees and wires hanging after a hurricane, you're gonna tell people, please stay off the roads, because, obviously that is a very serious situation that could cause risk to your health and safety. And so it is an interesting conversation, and I've been watching our residents, and I've certainly seen the responses, and I think it's just we're trying to get the information out there to as many residents as possible that will help them help us in this effort to get to some sort of stabilized normalcy at one point in the future. And that's all I see has ever taken place here, is just really a coordinated effort of individuals that care and are charged with keeping our community safe and are doing the best job they possibly can. So this isn't ever been an effort to minimize our residents' rights or what we feel is appropriate or not. It really is based on our health and emergency management professionals that have guided us in a direction that has led us to the numbers we're at today. So we do need to remain diligent, and I guess we'll sound like a broken record for a long time now, but we're going to sound like a broken record. And so as far as testing goes, there's a couple more questions with testing as well, and then I want to pose a couple more questions to the panelists today. But if one of the questions, and I guess Jonathan, Bob, if we have been out protesting, can we get COVID-19 tested without having symptoms?
Yeah, I'll kick it off, Jonathan, and sure want you to add to it. For about, what would you say, Jonathan, the last, I would say, 3 to 4 weeks, we've announced to everyone that for the community testing site at the college, of course, if you have one of the 9 symptoms for COVID-19, please call that 386-313-4200 number to get an appointment to be tested. But listen, you feel like you've been exposed, you're not feeling well, or you had another kind of infection like a UTI, or you just want to get tested. If you're out there protesting and you're concerned, just call that number, right, Jonathan? 386-313-4200, and you'll get an appointment.
Yep, you're exactly correct. Just call that number between 8 and 5, Monday through Friday. Our call center staff will make an appointment for you. And at this point in time, unless you've been locked in your house and have not interacted with anybody since this all started, I think anyone can make the argument that they believe they've been exposed to somebody. If you've been anywhere, you may have been exposed. And that's all you have to say. When you call in saying, I think I was exposed to somebody with COVID-19, I'd like to get tested, you will get on that list.
Right, Jonathan, there's no excuse for anyone in Palm Coast or Flagler County that if they wish to get tested, no reason why they cannot.
Correct.
And testing continues to be sort of a discussion point. So I'm going to pose this to all the panelists. Obviously we see mobility happening with the reopening. Can you talk a little bit about the other states, Bob, first and foremost, that are seeing a significant increase in positive cases? And then, again, with the contact tracing, and that continues to drive that, but what are you seeing, without, not just here locally, but everyone here is connected to a larger organization and group that continues to sort of see these trends and monitor them. What are you seeing as some of the indications and what we should really be concerned about? I know hospitalization and utilization continues to drive sort of different strategies and discussion points, but I'm hearing different things from different parts of the country on how their hospitalizations are doing as well and the impact of that mobility is having.
It seems like the western part, Mayor, of the country and the southern states are the ones that are among the 27 that have experienced a uptick the last 10 days in their total number of positive cases and their positivity rate of new cases, increase in cases over 10%. So we've seen a little bit of a surge. Case in point would be Arizona. We don't want to get to a place where, like in Arizona right now, they're concerned about their occupancy. They've had a real big spike in hospital admissions related to COVID, emergency room visits, as well as a higher occupancy rate. And so it is concerning for having enough and a really good supply of hospital beds, especially ICU beds. And of course, we talked about ventilators, having enough of those, although that doesn't appear to be a huge issue at the moment. It's just the number of beds. So there are several states experiencing it. Texas would be another state that we read about. So we are watching very, very closely trends here in the state of Florida for that reason. I know, Dr. Bickle, I know that is your concern as well.
Absolutely. I mean, there's a very nice website called COVID Exit Strategy, and they do a plot of each state using a variety of metrics and kind of put them into red, yellow, and green zones. In terms of red being, real not doing well at all. And I think I checked last night; it was 22 of the 50 states were in the red, including Florida. And it's looking at a lot of different trends. The other thing people need to keep in mind is that, sure, we're concerned about patient admissions overwhelming hospitals and intensive care units. That is like a disaster. We shouldn't even be getting near there. We want to be resuming normal activities with proper social distancing. That would be like such a failure that it's not even something we're kind of weighing. I mean, if it happens, we'll have to deal with it and maybe have to reinstitute these drastic measures, but we don't even want to get near that.
And that is what's happening in some of our states. So that's why we are concerned and we are wary, and why we say this is not over until when a vaccine is broadly administered to, well, the planet.
Yeah. And I do, I mean, that's part of why, we do take this seriously, right? It's preventative measures. That's really the approach we've been taking. So, about last week, I know we reopened, speaking of sort of the amenity aspect of our community, which, Palm Coast has many. We have, a public golf course, a public tennis facility, a sports complex, a community center, 125 miles of connected trails, several neighborhood parks, other recreational facilities, pickleball. I know our Parks and Rec team have worked with our Sports Alliance as far as the sports groups. Matt, can you speak to that a little bit about what that approach looked like, how that went, what you saw in the first week, and how the teams responded, as well as the coaches and all those participants?
Sure. So, it was, again, a very, very well-reasoned approach early on when we knew we were going to be eventually moving towards reopening phases, and we were developing a strategy for reopening the city. We saw businesses, we saw, all these guidance strategies being promulgated by either the federal government, state governments, professional organizations, maybe sports leagues, parent organizations. It became apparent that, we don't know everything as a city, and so that coordination, that working with our groups through the Sports Alliance, which is a very active group, to try to understand how we support each other, this is a community, and how we reopen strategically, and what that means. Each sport has different requirements. Each sport has different norms that they do on the field, whether it's a group huddle, let's say, in a football type environment, or a dugout hangout for traditional baseball, or so. What we found early on was we started the conversation through the Sports Alliance, and many of our sports organizations were very candid about a couple of things. They were excited to get back. They're excited to get back to the thing they love, which is their sports. But even internal to their organizations, there was a lot of questions, and there was reluctance by, one of them reported pretty high numbers of parents and families. Are we really ready to go back? What are we doing? What are we doing, meaning the sports organization? What is the city going to do? And so it was a very iterative, very cooperative strategy. And again, we've mentioned three that really stepped out and have been stellar examples. But again, the whole Sports Alliance is great, but the three that keep coming to mind as, I think, the leaders in that movement were, of course, Palm Coast Little League, the PAL Soccer, and Royal Palm Soccer, really came forward and said, this is what we think. We've checked with our national organizations. We've checked with regional organizations similar. We've done our homework. We've got templates, we're working with. What do you think? And what we've seen now, it opened on the 6th, so we're going on our third weekend technically, is very responsible approach, very consistent approach to what Dr. Bickle said. There's some little changes that groups are out there, yes, but they're distancing. Lauren showed pictures, yes, our Parks and Rec director showed pictures yesterday at our city council meeting, and I think she forgot to mention what you would notice in those photos is even during practice, they're distancing, they're being more careful with their equipment, right? So what that allowed us to do as a city, again, is what we've mentioned all the way along, is we have a role in those facilities maintenance. We have a role in public safety. And it allowed us to come alongside them and offer the support that we needed to, whether it's in facility maintenance or parks maintenance, or finding ways for them to attach safety equipment or sanitation equipment, or and just continue to look at how they're opening, to reopen again in cooperation, whether it's scheduling or different things, so that we can get back to some degree of usability, but do it under the guidelines that are generally accepted, hand washing and hand hygiene, facial coverings and distancing. And then other, peculiar, as I mentioned in one conversation, for the longest time, it's been a norm in junior sports, especially baseball, to wear a batter's helmet. And we just expect that now as a safety measure. Or a net. When we go to an MLB game, if you sit behind, the home plate dugout, there's a net. We take those for granted. Those are accepted norms in safety. So finding some of these new normals that accommodate the groups and that still facilitate play, but again, help us become better partners and better stewards as we move through this next phase and how long that looks like, and that the virus is still here, has been very successful. Again, very proud of our groups. And now, again, a lot of our parks have opened, and we have individual community users out. In fact, I was in Holland Park this morning, which is under construction. I was doing some tours and an inspection, and I saw a lot of users back to the parts of the park that are open. Again, our residents are extraordinary, as you keep saying, Mayor, which you already know. Masks, distancing, doing their activities. So somebody walking around with their hand sanitizer, that made them feel comfortable, make sure they were staying, clean. So it's been going very well, but there's a ton of work yet to do, and we will continue to communicate and to work with anyone who wants to get those plans through the Sports Alliance reopen and going again.
And, we're encouraged by the response, even with our golf course opening and tennis, and again, just those safety measures that we've put in place. Some of the things that, I think are important to note, and, we've got about 10 minutes wrapping up into our final virtual town hall on our COVID response. We just want to make sure that residents are, continuing to stay informed and up to date. So I know we have a communication strategy around that. I know the county is launching a Take the Pledge, business, wear a mask, protective gear, sanitation, social distancing campaign that Amy Lukasik from the Tourism Office and I spoke about today. So I have some additional information on that. We're going to be partnering and collaborating to get that initiative going. You will hear from us as a city as far as our approach on the request for mask wearing that we feel will hopefully help us take a unified approach. One that demonstrates we're all in this together, as a request to our residents and continuing to be a good partner and a valued one. And so, yeah, I think that we need to literally continue to hear from our partners, not stop doing what we're doing, and ensuring that our residents stay communicated. So first, Bob, I'm going to go to you from the health department as, how can our residents, from the health department perspective, what are your strategies continuing to move forward where they can get up-to-date information, accurate information, ones that will be helpful, continuing to call with any questions that you think, and just a closing statement that you would say. We've had over 30,000 residents viewed this town hall last week. So there's a lot of citizen engagement that occurs during these town halls. It's important to speak directly to those residents listening.
Yeah, thank you, City, Palm Coast, and residents, and all of Flagler County for being engaged. But, Palm Coast, 90,000 people of our community live here, and we just appreciate your interest and your listening to the guidance that we've been providing. So first of all, if you want updates on data, all you need to do is go to www.floridahealthcovid19.gov, and you can get all the information and data that we've been sharing with you over the last 3 months by just going there. I am really interested and excited about the Pledge to Protect program that Amy Lukasik and the TDC and the county and the cities are potentially going to be partnering with. This is all about opening up our businesses, opening up our economy in a smart and wise way so that we all can learn how to live with this virus, because it is not going away until that vaccine is broadly distributed. So we're about a year away from that reality. So in the meantime, what do we do? Well, the facial mask wearing, disinfecting, cleaning, keeping employees home who are sick, and social distancing, right? Those 3 to 4 things is what this pledge to protect is all about. And I sure hope it's greatly successful. I encourage our restaurants, our retail stores, our businesses to just jump on the bandwagon and just join us in our overall campaign to really, really press and to encourage the facial mask wearing. That is so important on top of the social distancing. Thank you all for doing that.
And Dr. Bickle, I'll give you a couple last-minute closing statements since everyone's becoming very familiar with your voice. And hopefully at one time we'll be able to see you in person.
Really, it's been so well stated by everybody that I just don't have much to add, that we're going to continue this campaign. We know in the health department what we have to do, and we're going to continue to communicate to the public what we expect of all of you. We really think we can succeed here, but it's going to take a valiant, determined, consistent effort.
Thank you. Jonathan Lord.
Yeah, so I'll read it the same thing that was said by everybody else, that the cloth face mask wearing when you cannot socially distance and holding to those social distancing rules of staying 6 feet away from others is extremely important to help us not look like the rest of Florida, and that we must continue to do that. And then just my last little pitch for hurricane season. For those who haven't already gotten prepared for hurricane season, please do build your kits, get your disaster guides from any of the grocery stores or any of the government facilities that are open. We can get you, or even reach out to us at that same number, 313-4200, if you need us to mail you one. Make sure you build your kits, and in your kits include a cloth face mask. And for those that cannot make their own arrangements for going somewhere, if your zone is told to evacuate, we will have shelters open. And in those shelters, we will do everything within our power to include providing masks and socially distance folks to make sure that we can shelter you from the storm as well.
That's great, Jonathan, and thank you so much for wearing many hats throughout the last few months between droughts and pandemics and the approach of hurricane season. So we really appreciate not only your leadership, but your consistency in keeping our residents safe. So thank you. Chief Forte.
Well, just to wrap up, a couple of thoughts. I wrote some down. Dr. Bickle mentioned it's either going to be masks and social distancing, or you're going to get testing and contact tracing. And it reminds me of where we've come. We have warning labels on cigarettes. We have visors that we put to screen the sun from our cars that we stick in the windshield with warning labels on them. We go through all these different places. They have warning labels. And I go back to more than 50 years ago, Ralph Nader wrote a book about cars can kill you. And that was introductions of when you should wear a seatbelt and putting seatbelts mandatory in cars. And that took 30 more years for that to translate into putting a law in place that you must be wearing a seatbelt. And I know at the end of the 80s, when most states came out with the law that you have to wear a seatbelt, it was, you're taking away my freedom. We go back to the basics of being a leadership or following, and if we as a city or we as a county decide not to enforce these rules of mask wearing, it's just going to perpetuate. And I think by taking the stand of being the leaders in the community, whether you're the county, the Department of Health, the hospital, we have to enforce the rule that it might be an inconvenience, but then it's better than 2 weeks in the hospital. And if it's not going to be you, it might be somebody you know. It sent a shockwave when 2 of our firefighters went out and got tested. One was possible, one was definite. It sent a ripple through the department. And if we want to be preventative and avoid the hospital stay, put a mask on. It's that simple.
Well said. Matt Morton.
I would just remind folks that while for now, the virtual town halls is the last one, and I'm personally sad about that. It's been a great joy and privilege to be engaged with our residents weekly, and with you, Mayor, and Bob, and Dr. Bickle, and Jonathan, Chief, thank you. All these updates will continue to be posted to palmcoastconnect.com. There's tabs for our virtual city hall, for EMS and fire information, for health department information, for COVID-19 questions. Again, if you can, if you will, I'll make the plea again. When you take the time to make an account, if you don't already have one, and we have over 10,000 residents who have an account, and submit a case, that case is like contract tracing for information for us. And we're able to see aggregates of, when, again, that's how we learned about, if you'll recall, the PEP tank problem we were having when they were getting clogged. We saw question after question and case after case, and realized we should communicate better that these paper towels, when the toilet paper is short, are going to clog up your system and cause you bigger problems. And so we continue to use that anecdotal data that we have too, the qualitative and quantitative analysis through there, and we learn things. And my point is, not only are we learning things now, but a year from now and 2 years from now, you're helping us go back and look at things we did, look at the questions, concerns, problems you had as our community, and it helps us get better and smarter and more proactive in our response. So if you can, please create a case. Even if you think it's something small, it's extraordinarily helpful for us now and into the future. And thank you for continuing to use that. And again, all that information in our direct communications for the entire city, palmcoastconnect.com. Thank you.
And thank you, everyone. Thank you again to, we would be remiss if we did not really recognize those essential workers that truly have been and continue to be on the front line of COVID-19, our healthcare workers, from our service industry to our first responders, all across the board. Tremendous sacrifices have been made for months at a time. To make this little sacrifice of putting on a mask, I think tells each and every one of them that we appreciate their efforts throughout this very serious event. And we are taking it seriously. We hope you will too. Tune in next week for the annual State of the City. It will be a great way for you to hear all the city updates. We will currently have a COVID response sort of wrap up as well, but really so many more exciting things going on in the city of Palm Coast. So we're grateful to have you. We're grateful you continue to join in. Continue to go on Palm Coast Connect, continue to check out our Facebook, a lot of great information on there, and please wear the masks and stay safe.